Two viewers are concerned about elder care issues and specifically nursing home wages, and want to know what, if anything, the legislature is going to do about that in this session. Anybody want to take a run at that? Should we start with you, Senator Kent? Your thoughts on that?
That is an issue that I hear about, and I know it's a real challenge in many parts of the state. As we are having the aging of our population, this is going to continue to be a challenge. But with the competing pressures this session on the budget, it's one of those things that I'm curious to see how somebody's going to pull that off. It's important. We need to figure out a way to do it, but I'm not sure if that's going to be able to be something we can pull off.
President Plowski, any thoughts?
Well, last session we did make investments with both the disability community and with long-term care. We gave them technically their first raise since the recession, and I think that's helped. My father is in assisted living. He had a stroke in 2008, and we live that every day. When I travel back and forth, he's in Red Wing, I will stop and we have a discussion, and I get to see firsthand what it's like to be in assisted living. And when you have a turnover of staff, it dramatically impacts the person. Dad has had issues, and he's got real issues when they don't know how to deal with him. And he's not bashful. He will at times get a little ornery. So we've had to come down and say, before, this person knew how to help him. This person does not, and they have to learn. And then if they leave, we start all over again. And remember, if you're in these facilities, the care is 24 hours a day. It's 7 days a week. It's total care. So I'm not only sympathetic, I see it every time I go back and forth, and I visit Dad at least twice a week going back and forth, and then usually we see him on weekends too. So this is a real issue, and if we have to, I would hope that this legislative session we would take a close look again at revisiting those wages and seeing what we can do to keep those people in place so we don't have that turnover.
Yeah.
Well, we want to make sure that seniors live where they want to live, and in most cases that's at home for as long as possible. And sometimes folks just need a little bit of extra help at home, so we provide waivered services and services in the home for seniors, and we want to be able to continue to do that so that people can live at home comfortably as long as they can, if that's what they would like to do. And then to provide a continuum of care for assisted living facility and skilled nursing care, which is becoming less and less prevalent, that it's more episodic. It's not a place to go to. It's a place to go for a while and recover back from. So what we're seeing is a great deal of expense in Greater Minnesota, and particularly in Medicaid and Medicare spending in the community and supportive services, and that's where a lot of the growth is. And that's a good thing, because that means people are being able to stay at home longer. But we can't control that cost. The cost is uncontrollable as it currently is, so we have to keep it under control. To keep skilled nursing care in Greater Minnesota, particularly in very small towns, it's a big deal, because that's close to family for residents, but also for very small communities. That might be the largest, or in some cases the only employer in town. And if you're trying to compete, the people working at that facility can travel a little ways and make significantly more money. They're having a really hard time keeping the doors open. One of the things that we're looking at is rate equalization, which means that in skilled nursing facilities, everybody in Minnesota pays the same no matter what. And we're one of 2 states that has that. And if what nursing homes are saying is that if we had the ability to charge more for certain services, that we could keep our doors open and provide more services to people, that might help keep the doors open for a little longer. We're going to be looking at that. We're also going to be looking at trying to make it a little bit fairer for how we're paying people in the zones that how people are paid for what they do shouldn't depend so much on where you live. And that's kind of what we're trying to look at to make it a little more fair.